If I have fillers at 27, would it have a long-term effect on my skin? Hello, I'm a 27-year-old female who was thinking about getting fillers under my eyes to reduce the bags as well as mild crow's feet you cannot see in the picture. Am I a good candidate? I'm also concerned about the long-term effects. If I get them now and maybe a few times more, but then decide to stop, will I make the bags worse? Thank you so much.
Thank you for your question. At the age of 27, you've submitted one photo where you're looking upward and I see some puffiness under your eye, and you're asking what are the long-term effects of using a filler to address the appearance of the puffiness under your eyes. So I'm going to help you understand a little bit about the anatomy and what fillers can and cannot do. So let's begin with what the issue is. I'm a cosmetic oculofacial plastic surgeon, practiced for over 20 years. I specialize in facial aging and in particular complex surgeries around the eyes. So I can share with you that what you're manifesting in terms of a problem has partial component related to something called lower eyelid fat prolapse, which is puffiness that doesn't go away, and that puffiness is fat that's around your eyes that's pushed forward, and at the same time there is some genetic or anatomic hollowing adjacent to the puffiness, and this area often referred to as the tear trough area, as well as the lowest part we sometimes refer to as the V-deformity of the orbit. So from your perspective, it appears that you're concerned more about hollowness, therefore you're thinking about a filler. And what is the downside of fillers? Well, when people come to us for consultations, very often they're afraid that they're going to have they're going to do fillers and they're going to be committed to having to do fillers forever. And they're concerned that they'll be going back to a much worse place by virtue of just doing the fillers alone. So let's understand the fillers that are typically used in this area. The fillers that is typically used is something in the hyaluronic acid family, or HA fillers. And an example of that would be a filler like Restylane. Now when we place Restylane in this area, the factors about the skin quality, the level of volume loss, and the viscosity of the material are all factors in how the procedure is done. No two doctors do it the same way, and certainly there are possibilities of issues such as bruising, swelling, swelling to the point where the filler actually is too much compared to the adjacent area, and there are patients who come to us from everywhere who need the material actually dissolved. So that's part of the risks of doing these fillers. Long term, it is not likely that you're going to be losing anything by doing a filler. The filler will be metabolized and your body will get rid of it, and your anatomy will basically remain the same as if you never had the filler. Time marches on, facial aging and genetics will continue. So I think that your concern about the long-term issues is something that has to be discussed in a consultation. To add to this, there are also other options, and I'll tell you a little bit about what we do in our practice. I have been using platelet-rich plasma, and platelet-rich plasma is this remarkable application of your own blood in a particular part of the blood called platelet-rich plasma. Basically, we draw your blood, we spin it down, and we concentrate a part of the blood that has the platelet-rich plasma that is rich in growth factors and so many things that help improve skin and skin quality, that we actually do a synergistic treatment where we combine the hyaluronic acid with platelet-rich plasma to get a more synergistic benefit, so the whole is greater than the sum of the parts, and we've been very successful with that. Now this is something that is individual, just like a surgical style is individual. So finding the right doctor that you can work with and feel comfortable and confident with is your next step. Meeting with a doctor who can communicate with you and examine you will allow you to have a more rational approach to what you can have done and what the long-term plan is. When people come to us, most of our patients, or I should say a large percent of our patients, stay with us. It's kind of like not only do we perform a surgical procedure, but we become the primary care doctor for their beauty needs for the long term. So having a plan and understanding that maybe you'll need to come once, twice, 4 times a year, whatever it is that's right for you, and seeing how that fits into your budget and your schedule are also factors in how you address the issues that concern you. So again, you do have options. I hope that the information about the fillers was helpful to you, and I wish you the best of luck in finding a doctor that you'll resonate with. So once again, I wish you the best of luck, and thank you for your question.